So as far as that, the best thing is probably just always having water around when they were younger. Once they learn to control it themselves, or one's a teenager, almost 18, and the other one's 28, so they kind of do it for themselves now, but over the years of just doing that for them, they kind of learn what they need and what they don't need for sports.
Has HED. What have you found to be the right balance between when people ask questions? Like he is pretty mildly affected, but his teeth used to be pointed. Now they're not. They're capped, but they're not capped, but bonded. But when people make comments like, "Oh, is he already missing teeth?" or what happened to his teeth? Did they fall out? Like strangers, what do you find is the right balance between respecting his privacy and how much information I should give? And does the checkout lady need to know exactly what is going on in my life now? And also, being like, this isn't something to be ashamed of. This is what is our normal and nothing to be ashamed of. Where is the line? I don't want to ignore it and just be like, oh, not comment. And then he starts to think there's something wrong or he shouldn't tell people, but also it's really none of your business. And I'll tell you if I want to.
Usually when we get asked about something from Zane or Virginia, we just usually educate them real quick and just say, hey, they have a special skin disorder and it involves these different parts of the body, teeth, hearing, all that good stuff that goes along with your syndrome that you have. And then just tell them about it, be open about it, don't be scared to tell them what they have.
Add to that, because I have two boys and they're 10 years apart, and the one that's older, I didn't tell anybody because I really didn't know a whole lot. I was just learning with him. So he's very shy and reserved about telling people about it, and nobody asks or questions. But the younger one, we kind of kept it open and told everybody and didn't care if people asked, whatever. People stop us on the side of the streets, they kind of pray over him. I'm like, sure, and didn't ask another question after that. Just did that, and I just let it happen, and it's okay. But the more we talked about it, the easier it was. And now the one that's 18, he'll tell anybody and doesn't care. It's much easier to tell people than it is to try to hide it and think it's something secret.
Mark needs something to do.
The microphone. This is really more of a thank you.
Certainly.
Mary Kay, I'm Lynette Davis from California, and you were like my best bud when Paul was little and Charlie was little. And I would call you and talk to you. I'd be crying. I don't know what to tell the doctor, those stupid doctors. And then he had a surgery that didn't go right. Something was screwing up. You were always on the other end of the phone. And you always took my calls. And I never realized until years later, how fluent she was becoming. Like she was becoming a big cheese at that point. And here I was talking to like the CEO. It'd be like calling and talking to Bill Gates, Can I please talk to Bill Gates? Oh sure, we'll just put you right through, And I was like, wow. So I just want you to know how much through all the years that meant to me. And you really helped me raise my son. And I just so appreciate you. And if you hadn't done what you did, if you hadn't started NFED, we wouldn't be here. We would be having this celebration. Thank you.
My son.
So, I have a daughter who's almost 13, and she had some fairly major surgery on her bottom gum over December just to have a bunch of teeth pulled. And because some bottom teeth were coming in and weren't going out, and then she's had dentures for a few years, and she had to take about a month off school as it healed and stuff. And we have sort of found in the last couple of months that sometimes I think that she is starting to feel that, or when she doesn't want to do something outside of the, go out to a place or something like that, she is saying that, her she can't eat or something like that. And we're kind of trying to find the right, okay, well, what's realistic? What is, obviously we know that she's got, a lot of discomfort, but also, we don't want her to miss out on things. And we don't want her to start feeling that she needs to hide away. So I was just wondering if you guys had any sort of examples along those lines and sort of ideas on, how you can kind of are motivated to go out or anything like that with your kids? Do you guys have anything like that?
Well, if the panel doesn't, keep thinking of your answers, but if there's someone in here who has a 13-year-old girl or someone in that age range, that you might be able to respond to that question.
Affected by HED. Actually, his is borderline unknown because it's a mutation I haven't seen before. But I've noticed that a lot of the little ones running around are very active, like my Jackson is. And I was just wondering, does behavior run hand in hand with it? I don't want to use the term ADHD because it's not really an attention deficit. It is a change in routine makes his activity level go off the chart. It's like, can somebody catch Jackson? Because he's in everything. And it's not an aggressive behavior or anything like that. It's just a change in, yes, he's hyper. And it's a change, I can remember when he was 2.5 and 3, feeling like that I'd been in a wrestling match to go out to dinner to keep him in his seat, just because he was everywhere all the time. And I guess my question is, does anyone else experience that? And is it something that they just kind of phase out of?
All right. Answers from the floor. Okay, but right behind you have an answer.
Levels kind of par for the course on what they've got going on. If they don't have a chance to get their energy out, they're gonna go a little crazy. And I was diagnosed with ADHD as a child and took medication. Wasn't the biggest fan of it and continued not to take it. But I think part of it's a lot of age and then get them out of their routine change. They're around friends, all of a sudden it's nonstop for them. It might be the same for 5, 6 year olds.
The school systems, and everybody's from different school systems around these 32 states that are represented in this conference this year. Do you feel like that your child's needs were met by your school system, or did you have to fight for them or beg for them? And we'll start with the panel, and then you guys can chime in if you would like.
I guess I'll start. I'm just gonna. I've always been in a pretty big city everywhere I lived, so honestly, yes. But a lot of it, if I had any questions or anything concerns, I advocated a lot of it. And I'm a teacher, so I know that if you are the parent and you advocate whatever you want, you'll get. The bigger cities, obviously, the bigger school systems are obviously a lot easier than some of the smaller ones. But yeah, I didn't have any problems with anything I needed to get.
Thank you, Caitlin.
We at the beginning of the school year sit down with my son's teacher and the principal and the PE teacher and anyone else who is going to be involved with him and discuss his condition. And they do things that even they had suggested some things about like putting a humidifier in the room. That was their suggestion. They did that. We always have a spray bottle with his teacher and in PE and stuff. As far as like field trips, I always had to go with him because if I didn't, they would ride a hot bus out there. They, might be walking around for 2 hours. One example was at a tractor show. Then they stuck them on a hot bus for 10 minutes waiting for the rest of the kids to get back. So I'm always there. I'm also a nurse, so I go as the school nurse because we don't have one in our school system or in the elementary school that's strictly for elementary school. So I don't feel comfortable ever with him being on a field trip without me because he doesn't have someone specifically for him to take him away. So with the teacher having 20 kids, she can't just take the whole class inside or something. So in that way, no, but in the way as PE, at recess, if he was to get too hot, he was allowed to come in and our school had a Wii, and so he could play the Wii. And also something that I really tried and worked hard for him to get was to be able to pick a friend to come in with him. That way he wasn't alone. So if he does get too hot at recess or lunch recess, then he gets to go in and play the Wii and have a friend come in with him. So that was a big deal in making him not feel like he was missing out.